dead can't look back. They were wrong.
This was the Age of Galvanism, a century entranced by the notion that a hidden storm lives in flesh. Decades earlier, Luigi Galvani brushed a metal probe across a frog's nerve, and the legs kicked. It felt like proof. Life carries its own electricity. But Alessandro Volta wasn't buying it. Stack copper and zinc with brine-soaked pads, and you can summon a steady current from metals alone. His voltaic pile, disc on disc, turned lightning into a switch. Flip and muscle answers. Demonstrations spread across Europe. Parlors and lecture halls dimmed their lamps so a spark would pass for a miracle. Showmen chased gasps. Doctors chased answers. And soon, two names would carry that switch into rooms built for the dead. Giovanni Aldini in London, Andrew Ure in Glasgow. In these theaters, philosophy could wait. Results came first, and results could look terrifyingly alive. January 1803, London. The body of George Foster, hanged that morning, is wheeled into Newgate. Aldini works quickly, linen drawn smooth, instruments lined to the right, the battery humming like a winter hive. Ozone stings the air. The cloth hisses where copper touches. Cheek, then jaw, then the muscles circling the eye. A crack of current. The face locks, half grin, half snarl. Physics, not thought. A murmur rolls through the benches. Someone's cane slips and clatters. A hat skids under a seat. Reports from the day insist one eye opened. Whether or not that's exact, the room believes what it sees. Currents command motion. To Aldini's supporters, it's a map of the nervous system. Wires to muscles, muscles to movement. To his critics, it's theater draped across a corpse. Either way, London leaves the building changed. 15 years later, the scene shifts north to Glasgow. The surgeon Andrew Ure records everything. Contacts, placements, the order of reactions. Clinical, where Aldini was grand. He touches the face, a dry snap. The mouth twists beneath the linen as if language were trying to return and had lost the door. Then, Ure takes a different route. From the neck toward the chest runs the phrenic nerve, a cable that can force the diaphragm to lift whether the brain wills it or not. He closes the circuit. The chest lifts once. Air moves. Then, stillness. It looks like breath. He connects lower, along the leg. The foot kicks. Hard enough, Ure notes, to nearly topple an assistant and scatter a tray of instruments. Around the table, the lesson hardens. Electricity can organize a body into motion. The audience wants more. Ure refuses the word resurrection. He has seen contraction. He has not seen consciousness. Newspapers rush to print breathless columns. Some marvel, some recoil. Clergy call it vanity with wires. Physicians disagree in letters salted with caution. And in cities already entertained by public dissections, galvanism adds a cruel new hope, that a body might sit up and draw a heroic breath on cue, but the spark that jolts a limb does not return intention. That is the hardest truth to learn in a crowded room. The argument splits. Vitalists, a flame leaves, life leaves. Materialists, signal in, motion out. No metaphysics required. The theater proves motion. The question is mind. Outside those rooms, another controversy swells. Anatomy schools need bodies. Resurrectionists clear graves by night. The scandal forces Parliament's hand. The Anatomy Act of 1832 creates a legal, supervised supply of unclaimed bodies from hospitals, prisons, and workhouses. From shovels to signatures. Fewer grotesque spectacles, tighter rules, and slowly, decades slowly, a path toward donation. From chaos to a code. From gawk to study. Let's pull back the curtain. A nerve at rest is a charged membrane. Apply a strong enough current and you depolarize it. Open the gates. So a wave of ions runs down the axon and the muscle fibers it commands contract. That's all galvanism needs to look uncanny. Gasp, grimace, kick. Reflex, not return. A gasp is the diaphragm obeying a signal. A grimace is facial muscle under orders. A kick is a pathway lighting up in sequence. None of it asks the cortex for permission. None of it returns self. The room saw motion and mistook it for life. The distinction is brutal, and it matters. Contraction isn't consciousness. Motion isn't life. Meanwhile, the spectacle escapes the lab and walks into literature. In 1818, Mary Shelley publishes Frankenstein. She never claims a single, tidy inspiration, but the zeitgeist is everywhere. Batteries stacked like towers, surgeons in frock coats, an argument about the spark of life. If Aldini and Ure staged the theater, Shelley wrote the tragedy that a century would remember. They were not charlatans. They were early explorers of neurophysiology, tracing what nerves do and how currents move through tissue. Their failures drew a map for safer practice. Controlled stimulation in the clinic, external shocks that can reset a stuttering heart, implanted pacemakers that keep rhythm when the body loses tempo, targeted deep brain stimulation that quiets tremor or lifts a locked gate. The same physics that twitched a dead hand would later pace a failing heart. Electricity never resurrected the dead, but in careful hands, it began to save the living. There is a line between curiosity and hubris. In 1803 and 1818, it ran across a cold slab, where science met spectacle and the dead were asked to perform. We still test that border. Every time we shock a heart, pace a nerve, or send a controlled current into the brain. Are we closer to understanding, or just repeating an old myth with better machines? What those rooms taught, beneath the gasps, beneath the headlines, was simple and sharp. Motion isn't life. But from those motions, medicine learned how to protect it. Reanimation or reflex. Tell me what you saw.